Hi, welcome to Snackable Health with Gibson and Kohli, and we're talking about the RSV vaccine. A lot of alphabet soup here with all these viruses, Pile. We're looking at a potential triple-demic here, right? Of COVID, flu, and now this other thing that people may not be familiar with, RSV, respiratory syncytial virus. We often think of it in babies and young kids, but it happens in adults too, huh?
Yeah, Mike, actually, the data tells us that most of us have been exposed or had RSV before the age of 2. But now we're in a different sort of time period because a lot of the pandemic babies have not been exposed to RSV. So, in adults, it's just a bit of a head cold. I sort of say it's symptoms from the neck up. You have a stuffy nose, you may be sneezing, you may have a low grade fever. But really, at the extremes of ages, the very young kids and the much older individuals is where we could have what we call lower respiratory tract symptoms, where it's kind of not just head up, but also involves the neck down and gets into your lungs. That's when we can get into a situation where the babies are ending up in the ICU on ventilators, and same for older adults or pregnant women. And what's unusual about this year is the fact that we have so much activity so early. Normally we see a peak in January. Now we're seeing it, in October, we're seeing the levels that we would normally see in January. So I think a vaccine would really be a breakthrough here. And the FDA, in fact, has labeled it as such.
Why are we seeing an earlier peak to this? I mean, what's different about this year?
I think part of it is the fact that for the last 2 years, our immune systems have really been sort of naive to the infections, to the respiratory infections, because we've been masking and social distancing, and a lot of us have not kind of been back to our usual activities. When that kind of opened up this summer, we started to see RSV activity in the summer, which is highly unusual, and it's been sort of steadily climbing since then. So we're very hopeful that at this time next year, there'll be sort of a triple vaccine, as you mentioned, for flu, for COVID, and for RSV. And the preliminary data from Pfizer on their vaccine suggests that it's got like an 81% efficacy or more. And we know that other manufacturers are working on the vaccine as well. Now, this vaccine uses the protein, the F protein, that the virus uses to get into cells. And it's a bivalent, it's got two different versions of that F protein with the Pfizer vaccine. So again, we're seeing great responses and a lot of optimism. And I'm hopeful that next year will be a lot easier. But this winter, we have to have our guard up.
Now, can any of us go get a vaccine? I mean, where do we get it? I mean, I just got my next booster round. I got my flu shot. Can I walk into CVS and say, hey, I want the RSV vaccine?
I wish we could, but not quite yet, because it's still in clinical trials, and so we're still waiting for full FDA approval on those RSV vaccines, which could hopefully come this season. That would be a little optimistic, but definitely by next season, it's looking very promising because the vaccine appears to be safe and it appears to be effective in protecting against severe illness as well.
Great. Thanks, Pyle. And thanks to all of you for joining us here for Snackable Health.